Blackburn, I'm your Bell County Judge. Welcome to our 11 o'clock Thursday COVID briefing. I've got a few comments I'll make at the beginning of this, and then I'm going to turn it over to Dr. Chadwell from the Bell County Public Health District. We also have a couple of representatives here from our healthcare providers, and I'll certainly give them an opportunity to make any comments that they might have. First thing I would like to do is announce that we do have 3 new testing sites that will be available within the next few days. I'll list the locations here in just a moment and give you a little bit of information about each one of those. The first one is a mobile testing site will be set up at the Temple Fire Station number 2 at 1710 East Avenue H in Temple. That will be on May 17th, beginning at 8 a.m. The second one is at Central Bell Fire and Rescue Fire Station, 100 North Main Street in Nolanville. That one will also be on May 17th, beginning at 8 a.m. The third one is in Killeen on North 4th Street. That one will be on Monday, May 18th, and also beginning at 8 a.m. There is, as with the previous mobile testing sites that we have provided through, or have been provided through the Texas Department of Emergency Management, there is a phone number to call for an appointment, and there'll be a health assessment done. And again, it is a symptomatic-based testing site. The phone number to call, and this phone number should be called no earlier than 24 hours prior to the test date. So I'm going to repeat that here in just a moment. But the phone number to call is area code 512-883-2400. And again, please do not call that number. They will not schedule an appointment for you any earlier than 24 hours prior to the test date. Again, those are 3 new test sites beginning on May 17th, and then the one in Killeen will be on May 18th. And we'll be pushing more information out about that through various sources, so that hopefully all members of the community and those communities will have an opportunity to access those mobile sites if they need to. I have got, as I did last week, I kind of went over questions that we've received in advance. I'll go through really just one question that I have received in advance. I think the rest of the questions that I've received are primarily for Dr. Chadwell, so I'll let her address those when she comes up here. The question that I received related to code enforcement efforts and issues, and the question was along the lines of just in general, how are enforcement proceedings working? And I don't have the numbers. I'll try to get those numbers to you after this press conference in terms of last week to this date. But here's my short answer in terms of enforcement efforts over the past week or so. And that is, as in the past, we have not given out any citations. The reason for that is twofold. One is the vast majority of businesses in Bell County continue to be compliant with the governor's orders. And so the investigation process and the approach process by law enforcement is simply to get the complaint, visit the site, visit with the owner, make sure they're aware of the regulations and the governor's orders, and then again, most of the time there is compliance associated with that. For the very few that I am aware of that we may have some compliance issues, that non-compliance really has only recently occurred, in my view, really recently since the governor issued or modified his orders with regard to beauty salons and the penalties associated with his orders. That modification of those previously issued orders in combination with an anticipation that the governor will be announcing some new orders within the next few days has presented, I think, a challenge for law enforcement and prosecutors in terms of understanding and knowing whether the current orders are going to be rescinded or modified by the next order that is issued, and to the degree that it might void any citations that have been issued in that interim time period. Those are the questions that I had received prior to this press conference. So at this time, I'll ask Dr. Chadwell to come forward and she can make her comments.
Good morning. I'll try not to speak too fast. I know I've gotten a couple of comments about me speaking quickly, so I'll try and tone it down. As of now, the last report that I saw was we were at 223 cases, but again, that may change between now and 2, so keep an eye out for that 2 o'clock update. The Department of State Health Services dashboard is now updating at 3 p.m., so if you weren't aware of that already, that is something to note. And I do have a number of questions I tried to group these thematically as I was taking notes on my answers to these, so they might not be in order of receipt. The first question, how has Bell County been able to stave off major spikes in cases and keep its death count so low, and what do I think is behind that? Without in-depth analysis, which will happen post-event, I don't have any strong evidence, but I have theories, so I'll share my theories. My first theory with regard to the major spikes is that it really does look like enough people are complying with recommendations from public health and healthcare to stave this off and keep these numbers lower and keep them from spiking too fast. Again, we'll dig into that a little deeper post-event and give better analysis to assess whether or not that's truly the case, but that seems to be my impression. The second theory with regard to the deaths being relatively low, thankfully, we have a young population here. Our population median age is about 30, so we don't have a large group of that elderly population that we're concerned about. We do have comorbidities in this population, that is health conditions that put people at higher risk, and of all of the individuals that have been hospitalized, my last count, we only had 5 people in that group that were not noted to have some sort of health condition that put them at higher risk. It may be that we just simply had not been given that information, but the majority of them did have health conditions that made them at higher risk for serious complications. But again, with a younger population, it looks like that morbidity burden, or I'm sorry, that mortality burden has been reduced for us, and I hope that continues. I hope we don't see any more counts on that death number. And let's see, the county has a growing number of recoveries. Have these residents had more mild or severe symptoms? Most of our residents that we have as confirmed cases have reported mild symptoms. As I stated, we've had, I do believe our count was at about 43 hospitalized. And so those were the more severe cases, but the rest of them have been fairly mild. A number of them have reported to us that they really didn't think there was anything serious wrong with them. Several have said they thought it was just allergies. So it's been fairly mild for a lot of people, which does make detecting it fairly difficult when someone doesn't think they have an illness worth going to get tested. Let's see. How many positive cases resulted from the Troy and Rogers test sites? We have not received results from those tests yet, but we'll notify once we know something. And can you provide an update on the number of people the health district has gotten in touch with through contact tracing? The last report I received on that was nearly 1,900. How many people called the health district about the possibility of being exposed to COVID-19 after the Belton Pizza Hut instance? Did that result in any positives? We got about 50 calls as a result of that, and we still have some calls trickling in, but so far no one has tested positive as a result of that possible exposure. And what is the health district's opinion of antibody testing? Do you think residents should be tested if they think they have the virus? So if you are symptomatic and you think you may have COVID-19, reach out to your provider and consider testing, absolutely. The antibody test, though, I'm just going to go through kind of a pro-con here with the antibody test. It's new, and we don't really know how reliable this test is. We don't know, for example, if you have a positive antibody test, were you exposed to COVID-19, or was it another coronavirus that this test is detecting? There aren't really good answers for that yet. I expect to see something confirming that a little bit more from the research soon. Now, if you want to talk pros of the antigen test, or the antibody test, I apologize. If pros of the antibody test, it might be slightly faster than the standard antigen test, but not by much. So it's really infinitesimal at best. There are really more cons associated with these antibody tests at this point in time based on not knowing the reliability of these tests. One, I already stated, is we just don't know if they're detecting COVID-19 accurately. A positive antibody test also does not mean you have any immunity, and that's really what people are latching onto. They think, if I have a positive antibody test, it means I'm immune. That's not what that means. So we do not want people to have a false sense of security and think because of a positive antibody test that they don't have to worry about getting COVID-19 again. You certainly could. We don't have an answer to that yet. And another thing, this is noted specifically on the FDA website, is that false negatives are very common with these tests. So just because you have a negative antibody test, that doesn't necessarily mean you may not have COVID-19. So please be aware of that. The next question, is the county tracking how many Bell County residents have tested positive via an antibody test? If so, what is the number? We do not have that number at this point in time. We were given recent guidance about FDA-approved antibody tests and counting those as probable cases, not confirmed cases, but that's so recent that we don't have a figure for you at this time. What is the possible end result of antibody testing, and what does it reveal to health officials? At this point, not a lot. Positive antibody tests might give us a sense of prevalence and who may have been previously infected before we had widespread testing that we're not aware of, but that's about the only thing at this stage that I can say we get from that. And that is all the questions I received in advance. Are there any others? Okay. All right.
Thank you, Dr. Chadwell. At this point, I'd like to call on Dr. Greenberg from Baylor Scott White.
Good morning. Bobby Greenberg, Emergency Medicine from Baylor Scott White Temple. I have a fairly brief update. Good news is that, as I reported last week, we are seeing stable numbers of COVID-19 within the hospital and within the community that we serve. It hasn't gone away, but certainly we haven't seen a spike that we were concerned about when we talked last week. We are trying to get back to business as normal, or as normal as we can. We have increased the number of surgeries that we're doing. We have the clinics back open, and people are starting to come back in to receive routine care, preventative care. Along with that, we have a program called Safe Care in the Baylor Scott White Health System, which includes screening visitors and checking patients and visitors to make sure that they won't be bringing illness into the building, safe distancing between caregivers and patients, and doing everything we can to make sure that we don't spread the disease and we continue to maintain the level of disease in the community as low as possible. On that point, one of the things we are seeing that concerns us is that people are continuing to try to avoid coming in for emergent and urgent conditions. We have a number of anecdotes, unfortunately, where patients have delayed or avoided care and have not had as good of an outcome as they could have if they come in right away. And these are serious conditions like stroke and heart attacks. So please access our system. Please access the emergency healthcare system as you need to. If you have an emergency, please call 911. If you have symptoms that you're unsure of, you can access our system through the app, through the website, or through telephone. And please follow the directions that are given to you by your care providers. And I believe that is all I have for this week. Are there any questions? All right, thank you.
Thank you, Dr. Greenberg. At this time, I'd like to call on Dr. Ahmad from Edmund Health.
Thank you, Judge Blackburn. I agree of Dr. Greenberg's. We are also not seeing any major spikes in West Bell County, Lampasas, and Coryell County, more than needed, and our numbers have shown the flattening is there. We see a strong support from the community, and regional hospitals are supportive of connecting with us to share the best practices, and those steady communication has helped us to move in the right direction. Our outpatient services, just like Baylor Scott White, we have ramped up our outpatient services. We are also, just like our Baylor Scott White partners, we are screening our patients, visitors. We are providing them virtual check-ins. We are providing them the PPE that they need at the time of entrance so that we can prevent any kind of spread in the community through their preventive care. As far as testing is concerned, as you may know, that we did have a drive-through testing as of effective May 11th this Monday. Because of our contract with our reference lab, we had to close down the drive-through, but that does not and should not impact the testing to the community. We are still testing and have capable ability, and the numbers are in stock to provide all the symptomatic patients, all the inpatients who are coming through our door, and all the scheduled invasive procedures that we are going to get any surgeries done are being tested before they get any surgeries. We are also providing and set up, with the help of PT Solutions, a post-COVID physical therapy program. So any patients who got COVID and they are recovering and they are going through challenges, we have a program in place for them. Last but not the least, we have a program which was instituted almost 6 weeks ago, and it has been successful, so I thought it would be worth sharing that all the patients who got tested in the community, and as you have heard that most of them were relatively less symptoms or minimal symptoms and stayed at home, we had ability to provide them calls appropriately till we felt they are safe to come back to the community, and we checked on them on a daily basis through our system. That's all from my end. If there's any questions, I'll be happy to take them. Well, thank you very much. Thank you, Judge.
Thank you, Dr. Ahmad. At this time, I'll be happy to entertain any questions that you might have or any questions I need to redirect.
Hi, Judge. This is Megan with KWTX.
Hi, Megan.
We have some questions on Facebook. A couple people are wondering about options for meals for seniors over 60. I don't know if you're able to address that at all.
I can, there are a couple of programs that I'm aware of related to delivering meals and providing those meals. I think the two places I would suggest contacting, and we can post this information and provide this after the press conference, but our Central Texas Council of Governments has been working with providers, and I believe there's some programs or a program available through the COG or a contractor that they contract with. And then there's also an organization called Hill Country Community Action that I think also has a program and some funds available for meals for seniors. And again, be happy to post that information on our website following the press conference. Any other questions?
I have a question for Dr. Chadwell. I apologize. I was having technical difficulties when she had opened it up earlier. I'm sorry.
Yes, ma'am.
Sorry for all the up and down. Last week I had asked you about when we might see some results from opening some businesses back up, and you had estimated about yesterday or today. Just curious what you've seen from that.
So we haven't seen any major spikes like I was hoping we would not, but I was prepared for the possibility. We are still kind of in a zone where we could, but that's why I'm very cautiously optimistic. We're keeping an eye on it, continuing to keep an eye on it. We saw a little bit of a jump to about 8 cases at one point, but some of those labs were from previously that were a little bit delayed. So I haven't seen anything really alarming, but I'm gonna knock on wood here now that I've said that. Any other questions for me while you got me up here?
One more real quick, just on the Pizza Hut, just curious if any other business, if you're aware of any other business that's had to close because of a COVID case with an employee.
Let's see, we had, and I'm trying to directly recall, I know that there was a Taco Bell that did close. We did not need a public notification because there was no public exposure, and that was reported previously. There was also, let's see if I can recall them all. Paul might have to remind me if he remembers. There were a couple, I'm trying to remember them all, apologize. I think there was a Chick-fil-A early on as well. And again, no public involvement. It was all within the facility, so no public notification was necessary there either. Those are the only two off the top of my head that I recall.
Okay, great. And with the Pizza Hut, the 50 people that called, and you said you're not aware of anybody testing positive as a result?
So far, no. We have not had anyone, and again, my investigators might have to correct me on this, but to my knowledge, we had not had anyone call that said they were symptomatic. I talked to several of these people myself, and they just let us know, yes, we were at the facility during this period of time, so we've said, now we need to push you under monitoring and keep an eye on you and see if anything develops that we have a concern about. So we're keeping an eye on those people to ensure that that doesn't happen.
And how about, does that include coworkers of this, other people that work at the Pizza Hut?
Yes.
Okay. That's all.
Hi, this is Jim from KCN. I have a question. Can you hear me?
Yes, I can hear you.
Okay, hi. I'm not sure if this is for you or maybe Judge Blackburn, but I wondered if there was an opinion you could give on the testimony that Dr. Bright Rick Bright has been giving on the idea that the U.S. does not have a good plan for a coronavirus vaccine, and without it, we may see a really big spike in the winter. I know there's a lot of politics there, but is there your thoughts on working on a vaccine and what we need to do there, and if you feel like there's going to be a big concern come fall and winter?
Sure. Now, I think that some of our medical professionals may have more insight on that than I do. I have a PhD, not an MD, but what I will tell you is my perspective on vaccine development is that they're in a really difficult spot. Whenever you're talking about developing a vaccine or a medication, you're weighing potential danger of that product to your patients and the benefits of addressing whatever health condition you're trying to address. So it's a nice tightrope walk that they're trying to figure out right now, and it's not easy to do. And so I don't envy those engaged in vaccine development the challenge of having to address that. I can't say what the pipeline on that looks like. I am not in charge of vaccine development, so I couldn't tell you when we're looking at seeing that. I'm seeing the same information you are. Is it possible that we'll have a resurgence in October? Yes, and that theory is based on what was seen in the 1918 pandemic with influenza, because there was a resurgence in the fall that was very, very damaging at the time. The fact that we are anticipating that possibility probably puts us in a better position than they were back then, but it's possible. I am not ruling anything out at this point. Does anyone else want to speak to the vaccine issue?
So I'll preface this with, I am an emergency physician, not an infectious disease or immunology, but when it comes to vaccines, it takes quite a while to make a good one. And there are, as Dr. Chadwell said, there can be significant risk to developing something too quickly and not being able to figure out what the side effects would be. We have definitely seen vaccines that were very well vetted, well thought out, and well tested come to the market and then be taken off the market because of significant side effects. So if you think about trying to develop a vaccine that you anticipate giving to a large amount of the world's population and not having it tested ahead of time very well, we really could do significant harm to a lot of people in a short period of time. So I understand everybody would love to have a vaccine. Vaccines do work. Immunizations absolutely work. I've seen a huge change in my practice over the years because of appropriate and effective vaccines. But we have to be very careful in not coming through with a product that could be more harm than good.
Okay, thank you.
And I guess I would just add from a certainly a non-medical viewpoint in terms of steps or what are we doing or anticipating a resurgence in the fall. And I think I mentioned this last week at the press conference, but again, the response that has been recommended to this virus, as I mentioned last week, is unprecedented. And so from my standpoint, as an emergency management official and emergency management planning, we are actively taking steps to plan and prepare for the next response, regardless of what the particular virus might be or might not be, whether it's COVID or something else. And so things like the personal protective equipment and making sure we have adequate supplies of that to the degree we can, improving our facilities, educating our employees, educating the public on social distancing, all of those kinds of measures are going to continue from my standpoint for the foreseeable future, and that would include the fall and probably beyond that as we go forward. Any other questions?
I have one more. Just
all right.
Of some of our viewers are asking on Facebook about if you have any update on the DMV reopening and what that process could look like.
We've been working actively with all of the county departments across the county on that. The DMV, part of that is a state issue in terms of when the state fully opens DMV offices. I think you can go to our website, and I know that our tax assessor collector, Shay Ludicky, has been pushing out information fairly rapidly in terms of the services that are available through his office and through DMV. And what I would encourage people to do is to continue to look at social media in particular for information about that. I believe all of the tax assessor's offices right now are open for at least appointment only. And I'll make sure we post something on our website if it's not already there, identifying specifically what the DMV offices operational hours are and how accessible they are to the public as of today.
Thanks.
All right. Any other questions? All right. Thank you very much.